she's a good girl. Yeah.
What's her name?
Her name is Maggie.
What is she?
She's a miniature. She gets crazy.
Oh, you're so sweet.
I love him.
She gets married.
Yes.
Oh,
She's really pretty today. It's a pretty blue on it. Yes, ma'am. You look beautiful today. And Maggie says, look at there. She says, oh,
Look at those kisses.
You got kisses.
Maggie was giving kisses.
Good girl. She'd sit right there by you all day long and just let you kiss her.
sweet.
Noodle, she loves the letter. All right, Noodle, there you go. Noodle's feeling treats out of my hand.
I just like dogs. I'm just an animal lover. I love dogs. And my daughter and son-in-law have a Westie.
Oh, that's
West
great.
Highland Terrier.
Yes.
And I had a little dog not long ago, but she had cancer.
Oh, I'm sorry. Well, I'm glad that we can bring a puppy dog in to visit with you, though.
I really appreciate it.
Good.
As I said, I'm just a dog lover.
We'll just have to come more often and let you visit.
Yes, do. You're so sweet and so friendly. You're just so friendly. Yes, you are.
I'm Nancy Bloodworth, and I'm with Compassionate Care Hospice, and we have started a pet therapy program where we bring dogs into a facility to let the residents pet them and hold them, and it's very comforting to the residents and brings them a lot of joy. They reminisce about when they've had pets in their lives and how much dogs have meant to them, and it's a lot of fun for the residents, and it's rewarding for us to bring the animals in and see the smiles on the residents' faces.
They're just remarkable results. When I started going, I took Maggie to see someone, and the gentleman was in a chair, and he was an Alzheimer's patient. His wife was there and said, I asked if I could pick Maggie up so he could see, and she said, well, you can, but he won't respond, and he won't say anything, and he's nonverbal. So I said, well, I don't mind, so I just went ahead and picked Maggie up, and he got this huge grin on his face, and her eyes just got like saucers. She was very surprised. So the next time I went back to see him again. Of course, it was during the week, and she wasn't there then. So I picked Maggie up and held her up, and he got this huge grin on his face again, and he's started speaking, started saying something, and I couldn't understand him, but he was still verbalizing. And then the last time, which was last week, I went over, same thing again. I picked her up, and he just started talking immediately. So it does them so much good to be able to interact with the dogs and to be able to pet them and see them, and probably brings back a time in their life when they had dogs. So we're real excited about the program. We really enjoy it, and I think everybody has a good time. All right, Maggie, you gonna do your song?
We're gonna have to stand over here so you can.
These are talented girls.
Come here, get out of here right here.
Sit.
Come on, Noodle. Come sit.
Check in.
Oh, what a good girl.
Girl. All right, keep you down. Look, sit over here. Down. Down. Roll over. All right. Good girl. Good girl.
You watch
Can you
carefully.
dance?
We're going to have to work on some of these. Oh, goodness sakes.
Girl.
We're going to have to work on some of
Okay,
those.
Maggie, come here. Maggie. Sit. Maggie, sit. Okay. Balance it. Balance it. Get there.
I'm Shanna Guy. I'm an RN. I work for Compassionate Care Hospice. We've been having a pet program called the Comfort Pack for over 3 months, and it's very beneficial not only to the patients but families, and as well as they go into facilities and everybody gets to enjoy them, not just our patient. But it's been seen. I've been a nurse for quite some time, and you can just see the patient's eyes light up. Sometimes it'll bring back memories that, you know, maybe if a patient has dementia, something that has, it's gone. You know, they're not able to remember things, but they do remember animals. Maybe the love of a pet that they had when they were younger, one that they may have had to leave, you know, at home when they went into the nursing home. It has also been known to lower blood pressure, reduce anxiety, and release, you know, endorphins that are pleasurable for patients.
My name is Dr. Catherine Williamson, and I'm one of the medical directors for Beaumont, Texas Compassionate Care Hospice. I've been asked to talk a little bit about pet therapy for hospice patients. In my experience, it's been a great thing. It gives patients something to love, something to hold that's warm and alive. It reduces their stress level and gives them hope. I think it's a great facility and a great tool for our facility.